Good afternoon, ladies and gentlemen. Bernard Harris here with the Pikes Peak Strategic Group and the Ameriplan Corporation. I want to talk to folks that are utilizing Medicare and TRICARE for Life. These are two extremely good medical benefits, but I want to direct my comments to folks to read what you're receiving from Medicare and TRICARE for Life. The big thing is Medicare One only pays up to 80%, not 80, but up to. Once Medicare gets through with their payment, whatever is left goes to TRICARE for Life. Once TRICARE for Life makes a payment, that bill for that particular medical procedure is over. A provider cannot come full circle and charge you after TRICARE for Life has made a payment. All right, now why am I bringing this up? Not everybody has access to TRICARE for Life. Not everybody has even Medicare. Now, for those that don't have, we with the Pikes Peak Strategic Group and the Ameriplan Corporation have what we call our CARES Group provider. These are folks that will take old medical bills and do essentially the same thing. But keeping in mind, we are not insurance. We are discount healthcare, but we are going to do everything we can to get your medical bills reduced. I will say again, if you do not have insurance, you don't get to pay a third or a half. You get stuck with the entire bill. Case in point, I had a medical procedure. The total amount billed was $122. What did TRICARE pay? $36.60. That's just under a third of the bill. So why should you pay a full price when we can help you get your bill reduced? I didn't say how much, but you can get that bill reduced. I will also add that with us, it's not consistent with each person. That means that what happens to person A, they might get a different amount than person B. But the point is, you're going to get a reduction. Add to that, if you're in a position where you have medical bills, that first time there is a $250 non-refundable payment, but your medical bills must exceed $1,500. Now, to kind of give you some more data and information, I'm going to have my partner, Ed Harrison, kind of put the icing on the cake for you. Ed, what do you think?
Well, I tell you, that hospital advocacy program with the Ameriplan Corporation has been around for a number of years. Thank you, Bernard, for that information. And I'm thinking about it is July the 7th, and we're still in the middle of this coronavirus. We're in a pandemic. And I just was speaking to a few colleagues this morning here in Colorado about what people are going to do with these medical bills. We've got people who are virtually, being in the hospital for a week, 2 weeks, and even longer if they have to go on a ventilator. And a lot of these people do not have insurance. Luckily, people like Bernard and others, or me, who have been in the law enforcement for a number of years, we put in 30 plus years, we were fortunate enough to get health care. We still, but we're over 65, so we do get Medicare, but we have a supplement that helps, pay that extra, those extra fees from doctors and so forth. So it's critical for a lot of us these days who do not understand, even if they have Medicare or don't have Medicare. It's like Bernard says, they pay up to 80%, up to 80%. So there still could be 25, 30% that you have to come up with. And once again, with the Ameriplan Corporation and our partners, the CARES Group, we're able to meet your needs and be that counselor that can come in and negotiate those bills over $1,500. As long as, and that one thing you have to keep in mind, if you've already litigated those particular bills or made a in advance negotiation with the hospital, we're unable to help you. But if you're one of those people out here, and we've got so many people out here who are uninsured, virtually millions and millions of people, and you're uptight about what to do about those outstanding medical bills, whether they're in the past or you have a loved one that's in the hospital, give us a call and see if we can help you. The call is free. Uh, we can talk to you individually, Bernard Harris, or my name, Ed Harrison. But I tell you, this hospital advocacy bill through our AmeriPlan program, and that program pretty much comes through with our $39.95 program, which you get dental, vision, prescription, chiropractic services, uh, and so forth, along with hospital advocacy and our telemedicine program. So we're going to talk a little more about those programs as we get into our second and third videos. But once again, if I can sum up, the hospital advocacy program is really designed for those of you who have these outstanding medical bills and you wonder what's going on. You don't want to file bankruptcy. That's another story. We're not lawyers or anything of that nature, but we can direct you to the right people that possibly can help you get those bills reduced. And that's usually based on what your income is. So if you have a lower income and you're making a deal on maybe $2,000 worth of medical bills, things could be reduced and you can get a few payments maybe for a year and get that paid off. Because one of the things that, as I'll sum up here, one of the things that is really hurting Americans these days and for the last decade or so are outstanding medical bills. That's one of the chief reasons why people file bankruptcy, and also outstanding student loans. But we don't deal with student loans. We're talking about hospital advocacy. But there's a big need out there for our product. So please take a look at the bottom of this website and give us a call and see if Bernard and I can help you with your outstanding medical bills. Hospital Advocacy Program through AmeriPlan. Thank you for your time. Have a great day.